I'm your host, Dale Sherbeck, and welcome to the HQ podcast. For those tuning in for the first time, the HQ is a podcast serial produced by CHA Learning and is your trusted source for important conversations on healthcare issues and topics from those that are leading and impacting the health system. Together, we'll explore these topics as we continue to learn together. CHA Learning is the professional development division of HealthPRO Canada and is uniquely Canada's only national fully online learning provider serving all of healthcare. So please check out more about our learning programs and services after this episode and discover how we collaborate with health leaders and organizations like those we feature on the HQ to empower healthcare professionals with the knowledge, skills, and relationships to impact health system improvement. Thank you, listeners, for joining me today for a very timely conversation. Over the past few months, most people in North America and indeed around the world have been getting a crash course in global trade and so many of the issues intended to be addressed by such structures as the World Trade Organization, common markets, and trade agreements. Notwithstanding the incendiary and jingoistic rhetoric of Make America Great Again and Manifest Destiny that is mobilizing hearts and polarizing nations, at the core of this complex issue is the push-pull between domestic prosperity and jobs and globalism. That fine balance between what we can manufacture or grow ourselves and that which we must trade or buy from others because we don't have our own supply or they can make or provide it better or cheaper. But together, it is an equation which either sums positive or negative, as a trade surplus or a trade deficit. The flashpoint for much of this discourse has come down to a singular economic tool, tariffs. It is an issue that continues to evolve and change almost daily, so the context may be different again on whatever day it is that you listen to this episode. But one thing that isn't changing is that tariffs would have both an immediate and long-term impact on all of us and life in Canada. We certainly have heard a lot about the impact on the auto industry, on agriculture, and the energy sectors. But what about the impact of proposed U.S. tariffs on Canada's healthcare sector? That is the conversation for today. Could these tariffs lead to supply disruptions or rising costs for healthcare providers? Is there a risk that these tariffs might impact the quality of care in Canada? How can organizations proactively prepare and safeguard the supply chains? And what does the future hold for cross-border collaboration in healthcare? To have this stirring conversation, I'm joined by two exceptional experts that intimately understand our supply chains. First, let me introduce Kendra Frey, Vice President, Strategic Sourcing and Innovative Solutions at HealthPRO Canada. In her role, Kendra provides executive leadership and strategic oversight across all sourcing portfolios, including pharmacy, clinical, support services, nutrition and food services, capital equipment, and signature services. She is responsible for delivering innovative procurement strategies that enhance efficiency, generate cost savings, and maximize value for more than 2,000 healthcare facilities which HealthPRO Canada serves. With extensive expertise in strategic sourcing, Kendra plays a critical role in strengthening the resilience and sustainability of Canada's healthcare supply chain. Her strategic vision and leadership ensure that HealthPRO Canada continues to drive market-leading solutions that support member organizations in delivering high-quality patient care. A certified supply chain management professional, Kendra holds an honors and a Bachelor of Commerce in Management Economics from the University of Guelph. Next, I'm pleased to introduce Nicole DeKort, President and CEO of Medtech Canada, the industry association representing Canada's medical technology companies. Before being named CEO in 2021, she spent 10 years as the Vice President of Ontario and Marketing for Medtech Canada, overseeing Ontario government relations and national marketing programs for the association. In response to the health system challenges we faced in the past few years, both the pandemic and the wait times and decreased access to health services in Canada, Nicole worked with her colleagues to launch medtechinnovations.ca, which highlights the vast impact that medical technology had in response to the pandemic and also highlights the tremendous role that the medical technology industry is playing to help address the medical service backlogs in Canada. And prior to joining Medtech Canada, Nicole had 15-year background in politics and government in a diverse portfolio of roles, including as an Executive Director of Strategic Planning for the then Minister of Health and Long-Term Care. Nicole also serves on the Board of Directors for Life Sciences Ontario, the provincial association representing the life sciences sector in Ontario. So hi, Kendra and Nicole, and welcome to the HQ.
Hi.
Thank you for having us.
So I am very, very grateful to you both taking the time to join me in this very busy time in our lives as we all debate this concept of tariffs that's going to potentially impact so many Canadians in our sector. So without any further ado, maybe we can just get right into it and start with the question, and perhaps it's at the stage for all of this, Kendra. Um, and at the risk of repeating something everybody else knows, I'm wondering if we can begin the conversation by framing what we're here to discuss today, and that's being tariffs. And because there is a lot of misinformation coming from none other than Trump himself, maybe we can start with the conversation about what is a tariff and how do they work?
Absolutely. Never a dull moment for the next 4 years, I predict, when it comes to the media. At the most basic level, Dale, US tariffs are taxes placed on imported goods, and that makes them more expensive to buy. And the goal here is to protect American industries. But in reality, it's actually the businesses and consumers, including hospitals, that are going to end up paying the prices. In response, you've got Canadian retaliatory tariffs being threatened as countermeasures imposed by Canada on US goods when unfair trade policies disrupt our economy. Now, here's kind of where it gets critical for healthcare as of February 2025. So we know that the US has imposed that 10% tariff on all Chinese imports. And of course,
Hmm.
that's reignited trade tensions. And in response, China has implemented tariffs of up to 15% on all US goods, including critical medical supplies. These actions are expected to increase costs for healthcare providers and potentially lead to shortages of essential medical equipment. And so apparently, the US plans to raise tariffs on medical products from China with rates anywhere for syringes and needles increasing from 0 to 50%.
Wow.
And then certain respirators and face masks are rising to 25% this year. And of course, all of this culminates in further strain on the healthcare supply chain. It's going to affect both providers and patients. And when you've got this push pull on pricing, you're going to see things like supply disruption, and you're going to see things in areas where you can't protect your pricing, increase cost to the healthcare system, which means potential reduction in services either elsewhere to populations or directly in.
That's a lot. So thank you for that horrible context. So maybe we can paint the picture a little bit further beyond that. So what are the biggest risks the healthcare providers might face if these proposed U.S. tariffs are implemented down the road, Kendra?
So first and foremost, costs are going up. That doesn't necessarily mean locked in pricing contracts are going up, but costs are definitely going up if these are implemented. They do add extra expenses to raw materials. And if you think about how interconnected our supply chains actually are in North America and the globalization of the supply chain, you can start to understand how compounding is going to kick in. So you've got raw materials potentially coming into Canada, and maybe there's some components and partial manufacturing that occurs in Canada, get shipped over the border to finished goods into the US, and then get shipped back to Canada. You can imagine what that looks like in terms of tariffs applied to each of those stages of production.
Hmm.
Um, it also means longer wait times for hospital equipment, surgical tools, diagnostic machines. All of those things are critical to patient care. And that's kind of the second biggest risk next to the cost increases that we're going to see. And then finally, over the long term, you're really looking at a potential reduction in access to innovative medical technology. If the tariffs discourage trade, which I mean, it is an economic tool that's being used here
Hmm.
to bolster one's own industries, but ultimately has the effect of discouraging trade, Canadian hospitals are going to have fewer options when sourcing cutting edge medical devices that improve patient outcomes.
So maybe moving with that then to you, Nicole. In terms of medical devices, I mean, what are the specific challenges do you foresee for Canadian medical device manufacturers and suppliers here?
So first and foremost, as Kendra has talked about, cost, the cost of medical technologies, it's clearly going to be a challenge, and not just the tariff cost on finished goods, but the tariff costs on inputs into the supply chain when manufacturing products. I think In Canada, we contract for medical technologies typically through procurement groups.
Hmm.
Some procurement groups do have um, clauses in their terms and conditions that may account for an unexpected cost added to a device like a tariff, but some of them don't.
Hmm.
And at the end of the day, manufacturers can't absorb these costs. It's not sustainable in the long run. So there is going to certainly be challenges on bringing medical technologies into the Canadian healthcare system where there isn't an opportunity for where manufacturers can't absorb those costs, and there isn't an opportunity to recoup those costs. And then, again, as Kendra mentioned, probably to me the more worrying aspect of this is supply chain challenges.
Yeah.
We have kind of had, so everybody saw during the pandemic, you know, in real time, supply chain challenges. And we saw that just for the goods and services really that were used in the pandemic response. But since the pandemic, and a lot of people don't realize this, there have been ongoing supply chain challenges across the healthcare system. So anyone who works in a hospital today knows that we are still dealing with a COVID hangover on our supply chain in healthcare. And it's kind of been like a whack-a-mole. Once one disruption gets resolved, another one comes along. It hasn't gotten better since the pandemic. So the supply chain in medical technologies is very fragile. And there's a lot of reasons for this. I mean, we've had a lot of inflationary pressures, we've had shipping cost increases, we've had shipping disruptions, whether that be strikes or natural disasters, due to climate change and things like that. So, we do have a very, very fragile supply chain in the medical device sector. And absolutely, there will be significantly more supply chain shortages should these tariffs go through on either side of the border.
So it may be obvious to some of our listeners, but I mean, when we're talking about medical devices, are the kinds of maybe some examples of the things that are disrupted or at risk, Nicole?
Yeah, that's a really great question. So when we talk about the medical technology industry, it's a very, very vast industry. So you're talking everything from sort of PPE and surgical equipment to pacemakers to MRIs to digital health to everything in between, right?
Yeah.
So if you really consider the medical device community, there's about, I think, around over 4,000 medical devices that get approved in Canada each year through Health Canada's regulatory approval process. So we're talking thousands and thousands of technologies. And, they range from what we call, well, they're classified as class 1, 2, 3, and 4 medical technologies. So a class 1 is sort of a less invasive, something simple like a wound dressing might be a class 1 medical technology, all the way up to class 4, which are much more sophisticated technologies, implantables, things like that. And for a lot of these different products, there are not hundreds of suppliers. I mean, because the industry is so vast and so diverse, for many different medical technologies, you're talking about a very, very small supplier community. And so this exasperates that, it's sort of the way the medical device community has developed and the way that it operates. It's not like shoes where you can just go and get shoes from hundreds of different companies if you'd like. It's very, very different in medical technology.
Sure. Well, maybe it's like some fancy shoes or rare shoes, perhaps.
Perhaps.
But yes,
Yeah.
but yeah. So, and I guess what you're underlying, I think the conversation here is that a lot of these devices and products that we're looking for are specifically sole sourced or available out of our U.S. market. Yes.
Yeah, I think somewhere around 38 to 40% of medical technologies in Canada come from the US.
Okay. So significant.
Yes.
So,
Yes.
Kendra, I mean, how significant then is the threat of supply disruptions to our healthcare sector due to these tariffs? I mean, maybe building on the conversation we just had, what specific products or categories are most vulnerable?
So the threat of supply disruptions in healthcare due to tariffs is not just significant, it's immediate and growing. And our supply chains in healthcare, in many things, but specifically in healthcare, they're so interconnected and rely on a mix of domestic and international sourcing. So when tariffs are imposed on those key medical products, it will lead to delays, increased costs, and shortages of essential supplies. Most vulnerable categories, if you kind of take into perspective that Canada imports over 65% of its prescription drugs from the US, and many of those depend on active pharmaceutical ingredients or APIs from China, we will see higher prescription drug prices, making essential medications less affordable, shortages of key drugs, forcing hospitals to ration treatments or find alternatives that may not be as effective. And it's obviously going to put more pressure on pharmacists and physicians who then have to navigate those supply constraints and adjust their treatment plans accordingly. From a patient perspective, that means delays in getting the medications, increased out-of-pocket costs, and even going without critical treatment. So many different players in the system affected by this. Focusing specifically on healthcare, we've seen some of our own members take clinicians off the front line to manage this kind of whack-a-mole effect and COVID hangover of supply disruptions. There's whole departments now managing upwards of 1,800 different supply shortages. So this is going to exponentially add to that if it's put into place. And it robs patient care. It just takes all of the services away from patients. Other kind of areas of concern would be X-ray machines, any kind of precision diagnostic tool like MRI machines, CT scanners, lab testing equipment. Many of those pieces of equipment, they rely on imported semiconductor chips and specialized materials, both of which are impacted by tariffs. So hospitals might have to delay replacing aging equipment. That's going to lead to longer wait times for diagnostic tests. And that's, potentially that's not very good for patient outcomes. Things like implantable medical devices and surgical equipment. So everything from hip implants to pacemakers to robotic surgical systems, those are all at risk. Because of the medical grade metals and components that go into making those products. And I think, one of the things I kind of want to put up an idea out there in today is just when you work with a group purchasing organization, we are working to actively mitigate those risks. So we've got, diversification of supplier networks in our multi-supplier award strategies. That's going to reduce reliance on single country sourcing, including US and China, negotiating longer term pricing agreements, shielding hospitals from the sudden tariff driven cost increases. Of course, we do a lot of advocacy work in working with associations like Nicole's at Medtech, as well as working with policymakers to push for tariff exemptions on critical medical supplies. And then, of course, providing real-time supply chain intelligence so that the healthcare organizations can make data-driven procurement decisions. So those are some of the benefits in working with a group purchasing organization and collaborating across the country, such as the role that HealthPRO Canada plays.
Thanks, Kendra. I think certainly a common theme that comes from the conversations we've been having for the last month or so is the need for Canadians coming together on these issues. So I totally agree with you. So you've also teed up a little bit of the question about the impact this is going to have or would have on patients and health services. But I don't maybe to bring it back to you more specifically. Anything else that you would like to sort of comment on that, Nicole or Kendra? In terms of, why should we really care about this?
Yeah, maybe I can, I'll start, Kendra. I think one of the things that we all need to be really aware of is that, I say this all the time, the entire world is still catching up from all of the backlogs to health services that were created because of the pandemic. So not only are we, trying to get back to normal, we're not back to normal. We're still trying to catch up. And so, you know, I see the risk to health services in a few ways. So number one, obviously not having the technologies you need are going to continue to prevent us from being able to make sure that patients can access the health services they need or the surgical procedures they need in a timely way. It's also going to hinder our ability to catch up with those backlogs. And I know that those in the healthcare system are working very hard to try to do that. But I mean, we're in 2025. The pandemic started in 2020 and we're not there yet.
Mm-hmm.
So think about that. And then, there's a sort of a second piece to this where there's the status quo, and then there's how this will impact our ability to capitalize on medical technologies that help with better patient outcomes, help with health system efficiencies, help with backlogs and wait times. So we're talking now more of the innovative, disruptive technologies that, we've been talking for years about what we can do to try to get those technologies into the system. And we're not a great adopter in Canada compared to other jurisdictions of those technologies in the first place, let alone what this will do to take us years back and years behind in where we're at in being able to capitalize on those technologies. And, I think for us to be able to get our healthcare system to a place that is, number one, serving patients in a timely way, and giving them the best health outcome possible. And number two, helping with long-term health system sustainability. So you're making investments in innovations that might cost more upfront, but are actually saving money across the whole healthcare system. So we not only have this short-term risk to current health services, backlogs, wait times, but our long-term risk is that we're going to continue to lose momentum on being able to make our healthcare system sustainable in the long run and to make Canada a world-class healthcare system.
Yeah, well, it's hard to go forward and you're always looking back. So,
Mm-hmm.
but yeah, and I think as you raised, and I think as we've talked about before, right? I mean, the pandemic has impacted the acuity of patients because of delays in diagnostics, and people are coming into the system sicker. So I think what you're describing is something a bit of a rinse and repeat, but perhaps even worse in the fact because we haven't even recovered from the previous backlog.
Mm-hmm.
Anything else you want to add to that, Kendra?
Like you're going to see cutbacks in services. You might see a reduction in elective procedures or specialty programs to offset the rising costs. I think there's definitely going to be higher costs for patients, whether that's through medications, prescription medications, diagnostic tests, potentially private sector healthcare services, and then longer wait times because budget constraints mean fewer staff and delayed investments in new equipment.
So, learning from the past, that's what we're here for. What other lessons might we take from the pandemic? You've both brought it up a few times already, certainly our most recent crisis. But what can we learn from that may perhaps help us to prepare for the potential impact of tariffs?
So let me just say, here's the good news.
Thank you.
The one thing that the pandemic taught us is the power of collaboration. The pandemic was really the first time, I've been at MedTech Canada for 13 years, but the pandemic really created kind of in the moment, in this crisis that we were all in, this really strong sense of we're all in this together. And that we're all in this together mentality just opened up the doors to different parts of the healthcare system, all speaking to each other, collaborating with each other. And I know for industry, for the medtech sector, there's a lot of barriers to having those conversations. And I think that's a huge lesson that we can learn coming out of the pandemic is that we have to treat each other like we are all equal partners in our healthcare system,
Mm-hmm.
and that we need to listen to each other. We need to really hear each other, and we need to work together to find solutions. And if we don't do that, we are not going to get through this. We will not get through potential trade wars, and the potential impacts of tariffs. But I think there's a lot of parts of the healthcare system that learned that during the pandemic. So, and whether that's hospitals, government, industry, purchasing groups, physicians, nurses, everybody, I think that's the biggest thing we need to make sure we are doing moving forward.
Thanks, Nicole. I totally agree. We are better together and stronger together, too, for sure. And that's one of the lessons certainly I took from the pandemic myself. Kendra?
I think there are pathways that were forged during all of the COVID emergencies and the hard times that still exist today. So that's a really great thing that we should leverage in terms of having those times to collaborate, whether they're communities of practice or relationships with policymakers, et cetera. Broaden that out to make sure that all stakeholders are heard at the table. I think, additionally, when it comes to different strategies from the lessons learned, diversification would be number one. Having multiple suppliers across different regions so we're not overly dependent on one country.
Mm-hmm.
I think too, it's also worth mentioning stockpiling. And that doesn't mean, calling your supplier and ordering twice as much as you did last week. It means we have provincial stockpiles and a national emergency strategic stockpile serving the country federally, as well as individual stockpiles in each of the provinces. And so making sure that we are supportive of those stockpiles and drawing supplies like PPE, ventilators, and pharmaceuticals from them, I think that really matters, and that will give us some protection. That is what they were designed to do and created completely because of what we saw in the early days of the pandemic. I think as well, domestic production is crucial. I know it takes time and investment, and it's not necessarily the most realistic response right out of the gate. But it still stands to reason that countries that manufactured their own medical supplies had a huge advantage during the.
Yeah, and I think post-pandemic, our looking inward in terms of our capacity of developing or manufacturing our vaccines ourselves was certainly looked at as an opportunity for improvement. And I think, as you're describing, Kendra, many other devices and objects in our supply chain certainly could be looked at and be made in Canada as well. I guess one of the things that we look at or we continue to hear through the media is this, the impact of this is going to have on the cost of living, right? At the economic hurt that it's going to bring to all of us Canadians about whether we're able to find things. And if we do, it's just going to cost more. And certainly as part of what you've been describing as well is the cost of, or the increased cost of products on our healthcare organizations and hospitals. But people work in our healthcare systems as well. And so have you given any thought or consideration in terms of what the impact is going to be on our health workforce if all this comes about as well?
Absolutely. I think, imagine trying to build a house and you don't have the tools, or you don't have all the tools. You only have some of the tools. It would be a very frustrating experience. It would make it very difficult for people to do their job. And certainly you wouldn't be able to do your job to the best of your ability. And I think our health workforce has been through a lot, really just a lot. And I mean, we have an incredible health workforce in Canada filled with amazing people who work really hard to put patients first. But it's a bit of how much more can they take, And so continuing to make it harder for the health workforce to do their job by not making sure that they have the tools they need and not making sure that those tools are accessible when they need them. And that sort of also adds to the cost piece of all this as well. But not being able to do that is going to exacerbate frustrations that already exist in our health workforce. We've been talking since the pandemic about our health human resource challenges. We've been doing whatever we can to try to augment that, at least from the medical technology industry perspective, and really trying to focus on how we can help our health workforce. And there are a lot of medical technologies, like I said, that don't just increase your patient outcome and give you a better patient outcome, but they also help augment some of the work that our health workforce is doing to allow them to be able to focus on the things they need to focus on. So I think it would have a really negative impact, and I just don't think that we should be piling on to a community that has been through a lot over the last 5 years. We should be doing everything we can to help support our healthcare workers.
Thanks, Nicole. Well said, and I couldn't agree more. I mean, so when we hear the themes that we've been talking about over the last 4 years, around the moral distress, the challenges with retention and recruitment, and I think, as you've just been describing, this would only continue to exacerbate that. Kendra?
So I think that really paints an important picture. Kind of more specifically, I think when you're faced with higher costs for medical equipment, pharmaceuticals, you obviously have to make budget adjustments elsewhere in a public healthcare system. So what does that mean for the healthcare staff? Potentially hiring freezes or staff reductions, more pressure on the existing workers, means delaying your equipment upgrades. So that's going to force a doctor or a nurse to work with outdated, unreliable tools. And then continuing cuts to training programs, education, and of course, that's limiting professional development opportunities. Just more stress. It's increased patient loads and more stress and longer shifts, all kind of leading to more burnout. And that's all we've been talking about for the last 5 years. They're already stretched thin, as Nicole quite eloquently said. I think when you force your frontline workers then to have to source alternative products in the wake of supply shortages, you're potentially getting lower quality, maybe not having the same level of protection in a PPE product as we saw during the pandemic, rationing supplies, putting both the patients and the healthcare workers at risk, and then more time, like we said earlier, with frontline nurses being called onto medical device shortage teams or drug shortage teams, searching for workarounds instead of actually focusing on patient care.
Mm-hmm. Yeah, so time and energy taken from the things that we care about and need most, I guess, in terms of how to get better. So thank you. So maybe Kendra, you talked a little bit about some of the value of organizations like HealthPRO Canada. Could you maybe describe a little bit more in terms of what your organization is doing to support its members and help mitigate these kinds of risks?
Absolutely. So I think our multi-supplier award strategy and contracting is really key to creating that diversified supplier network. We do have contracts with domestic providers as well as providers outside of the US. It just really provides us with more options, and that's at a HealthPRO level. Additionally, we don't contract for 100% of volumes, but there's always an open portion within each of our contracts that allows suppliers to start to build up their business if maybe they can't support the entire country or even an entire province. I think as well, the fact that we negotiate stable pricing agreements through our competitive bidding processes, we always understand what we're going to see in each subsequent year of the contract, whether that is a maximum escalator or firm pricing. I think it gets really tricky when, a supplier might not be able to perform its contractual obligations under that pricing agreement
Mm-hmm.
because of tariffs. And that's when you get into a whole bunch of complex, yet to be litigated in common law setting issues around force majeure.
Yeah.
I won't get into all of that because I don't have the answers. That's going to be a learn as you go type of situation for many of us. But I will say that there are many legal articles written right now in the past month that indicate any kind of litigation that has existed around pricing increase and not being able to perform a contract because your costs have increased. They haven't been related to tariffs. In the context of those case laws, it's been related to the increase in supply costs. So two very different things. So very interesting times legally.
For sure.
Back on HealthPRO Canada and the actions that we're taking. So aside from having those contracts in place with stable pricing, as well as the diversified supplier networks, we are also actively engaging at multiple levels of government and with multiple associations and with our members across the country and advocating for policy changes. So pushing really for tariff exemptions on products.
Good. Well, thank you for that work and looking out for the best interests of so many health organizations. And yes, I can relate myself in terms of I think so many people learned what the word force majeure meant over the last 4 years, and it may come back again in terms of our understanding. So, Nicole, so I think as Kendra outlined at the beginning in terms of the understanding of tariffs, I mean, Trump is assuming this is going to be just a magic fairy wand and that he's going to increase domestic production because he's implemented this. But similarly in terms of our own country, and I think you alluded to it in one of your other answers, why is it not as simple as just increasing our own production in some of these areas, and maybe exploring that in a bit more depth, if you will.
Yeah, so that's a great question. And I want to break this question down into sort of a few things that I think are important for people to know about the medical technology industry. So first of all, would tariffs lead to increased opportunities for domestic production? Yes, that's the goal of tariffs. I think in the long term, it would in some areas. I think, though, people really need to understand that manufacturing in medical technologies and setting up manufacturing is no easy task. So we're one of the most highly regulated industries. There is significant regulatory burden when you're setting up a manufacturing facility. That is also goes hand in hand with increased costs, increased regulatory scrutiny. So it's not something that would happen overnight by any means. And people need to be sure that I guess we don't want anyone misled by what we saw during the pandemic. So there was a lot of domestic manufacturing for certain medical devices during the pandemic, typically things like PPE. We saw that ramp up. We saw other sectors jump in. We saw lots of people trying to help. But number one, a class one manufacturing of a class one medical device, so a more simple medical device, is very different than a class 2, 3, and 4 medical device. That's one thing we have to keep in mind. We also have to keep in mind that the federal government did reduce and reduce the regulatory burden during the pandemic to make it easier to ramp up on certain products. And that framework does not exist today. Today, we're back in the pre-pandemic normal of the regulatory burden. So, perhaps in the long run, it could increase opportunities for domestic production. In the short term, that is a huge challenge. Very difficult. It's very difficult to move manufacturing facilities for medical devices or to start new manufacturing facilities for most medical devices. The second piece in here is we need to pay close attention to the reaction in Canada, because there's the federal government reaction when we're talking about retaliatory tariffs. But above and beyond that, you've seen premiers across the country having their reactions to tariffs. And at the provincial level, the reaction is this buy Canadian or don't buy American sentiment, right? So when we think about ramping up domestic production, what are we talking about? Are we talking about Canadian companies beginning to manufacture technologies that we don't manufacture in Canada? Or are we talking about investment from US companies in Canada for domestic manufacturing? And I think, every province, we're working with almost every province in this country right now and the federal government on provincial and federal life sciences strategies. And every province since the pandemic that we've been working with has said they want to grow the life sciences sector in Canada. But you got to think through, what does that mean, right? And so when premiers say, don't buy American, and they're talking about American companies, well, then, yeah, we're not going to attract opportunities for domestic production, as opposed to buying from an American company that is producing technologies in Canada, in Canadian manufacturing. So again, I think some of the knee-jerk reactions to what's going on right now are concerning.
Mm-hmm.
And one of the messages that we've been, trying to espouse from the medical technology industry is we need cooler heads to prevail when it comes to our sector. And we need to be very thoughtful. And we need to really understand what this sector is and what it means, because we are not a homogeneous sector. It's not the kind of sector that you can just pick a lane, this is what we're going to do, and this is how everything's going to end up in the end.
Yeah, and I think, as you say, it's nuanced, and difference between buying Canadian, buying made in Canada, and yeah, I imagine almost a decision tree sort of approach that what can you do, what can you not do, and then as a last order of business, then you will pay the tariffs, I guess, or the imported products, but there's some alternatives and not other alternatives available to us. So maybe in that cascading sort of effect, Kendra, sort of bringing back to you, the economic sort of impact of that on our healthcare system. And in all fairness, I know you're not an economist, so but just in terms of what you understand of the situation, what is this overall cost going to be to our health system in Canada if these tariffs come through?
I think this is a really great question, and I would love to have an economist talk to us about it. But from my perspective, let's look at what happened during the COVID-19 pandemic when the US placed restrictions on exporting N95 masks and ventilators to Canada. Before the pandemic, an N95 mask typically cost between 75 cents and $1.50 per unit. But when the US restricted those exports, the demand skyrocketed and prices surged to as much as $12 per mask. So hospitals and long-term care facilities were forced to pay up to 15 times more for essential PPE to keep their healthcare workers safe.
Hmm.
The economic impact there, we had to spend hundreds of millions of dollars more than anticipated just to secure protective gear for frontline workers. And then the policy lesson, I would go so far as to say, without tariff exemptions or secure trade agreements, that same type of cost explosion could happen again. But this time it'll be medical devices, prescription drugs, and hospital equipment. Another example is back in 2018 when the Trump administration imposed tariffs on steel and aluminum imports.
Mm-hmm.
That might not seem like a healthcare issue at first, but there was an impact. Medical devices, from hospital beds and IV stands to CT scanners and surgical equipment, rely on that kind of material. Mm-hmm. And after the tariffs were imposed, you saw MRI machine price increases go up between 8 and 12% due to the higher steel costs. Hospitals faced longer wait times for new equipment as suppliers struggled with the supply chain slowdowns. And the overall cost of replacing aging medical devices jumped by millions across Canadian healthcare facilities. So those are the kinds of cost increases that ripple throughout the system and ultimately affect a healthcare budget, procurement decisions, and patient care. And we're going to see history repeat itself if the tariffs are implemented and there's not a healthcare exemption. It creates volatility. It's not just about increased costs. But that's really essentially what we're talking about. And so I guess, when you look at what can you do to limit that economic damage to the healthcare system? Like I've said a couple of times, but it's worth repeating, push for tariff exemptions on essential healthcare goods. invest in domestic production. We know that that's not a short-term fix.
Hmm.
We talked about diversification of supply chain. We talked about using group purchasing organizations like HealthPRO Canada to leverage aggregated volume, better pricing, longer-term contracts. But also, I think I would go so far as to say there's, a public duty in voting and things like that kind of matter in these times. So consider this as one of the most critical issues to influence and get out and do that part as well.
Yes. Well, looks like we're going to have a few opportunities to do that this year. So, um, so, but yeah, and I guess I mean the other part, I guess, to that economic equation that you described, Kendra, is that I guess the economic context of Canada is different than it was 5 years ago when we entered into the pandemic, or when Trump was last in power 8 years ago. And so, do we have the capacity of withstanding some of these things, or infusing more, debt into our systems when we're still just trying to claw our ways out of the last crisis? So, yeah, I think it's a very challenging time for us economically, and for our health system as a result of that. Um, bigger picture, Nicole, international trade expert that you are, what role do international trade agreements play in mitigating tariff-related disruptions in our healthcare supply chains?
So before I answer that question, I'm going to pick up on one thing that Kendra said.
Hmm.
Um,
Please.
we only need to look to the South to know that elections matter and voting matters. So I'm just going to leave it there, but say, be thoughtful in your voting patterns and understand that elections matter and they do make a difference on people's lives in a very real way. That's my political background shining through. I heard Kendra say that and thought I got to reiterate that with everyone. When it comes to international trade agreements, I think maybe one of the things I think it's important for us to talk about as well is let's talk about our Canadian-based companies. We have incredibly innovative, phenomenal Canadian-based companies in the medical technology industry that are coming out with these incredible technologies all the time. We have a great ecosystem to create new medical technologies in Canada.
Hmm.
Most of those technologies are sold first to the United States and primarily to the United States. So, number one, this tariff threat is really, really dangerous and significant for our Canadian-based companies. Um, International trade agreements play a huge role in mitigating tariff-related disruptions in our healthcare supply chains in general, as long as international trade agreements are being followed. I mean,
Yep.
that's the key, and I think that's the instability right now, or I guess the constant guessing game of what's going to happen or what's not going to happen and where things going to go. I mean, it's really difficult to make business decisions when you don't know the rule book and you don't know if the rule book is going to be in place long term, or whether the rule book is going to suddenly change on a dime tomorrow. It's very difficult to make business decisions under those circumstances. But I will say that our international trade agreements with any other countries, for example, Europe, thank goodness we have them.
Hmm.
And I think that for both Canadian-based companies and for our healthcare system, the more trade agreements, the better. I mean, we have a very clear position in the medtech industry, and it's that we support global markets and global free trade, and would really like to see more and not less.
Yeah. Thanks, Nicole. Appreciate that. And I'll come back to your conversation at the end, maybe as a closing question. But so, um, Kendra, maybe as we're getting close to an end here, how can healthcare organizations balance that, that shining sort of star, that balance between cost efficiency with the resilience, and their own procurement strategies amidst these kind of tariff uncertainties?
strategies, but definitely worth reiterating. I think it's a delicate balance, as you say. You cut costs too aggressively, you could leave your organization vulnerable to shortages. You focus too much on resiliency, and you could drive up your expenses. So I think there's a few strategies in the toolkit that we need to pull out. We've talked about expanding supplier networks and diversification, looking beyond the US manufacturers to source medical devices and pharmaceuticals from Europe, Asia, and domestic Canadian suppliers. Leveraging trade agreements like CETA, the Comprehensive Economic Trade Agreement between Canada and the European Union, allowing tariff-free access to medical products from the EU, reducing the reliance on US imports. And then further exploring nearshoring options, so working with suppliers in Mexico or other North American countries, offering middle ground between cost efficiency and supply chain security. I think those strategies, combined with the stockpiling the critical supplies, using our existing stockpiling networks provincially and federally, another key strategy. I think leveraging your purchasing organizations, opting into the longer term contracts to shield you from cost spikes, but also to keep you resilient in the wake of supply shortages. Using AI-driven analytics to identify kind of new tariff-exposed products and assess your risks on a regular basis. I don't think we do enough of that in healthcare. We're a little bit late to adopt some of these technologies, but they do exist. And perhaps there is a way through collaboration to reduce any one individual cost to that end. And then, of course, you've said it before, advocate for tariff exemptions on critical medical supplies. And that's, again, where what Nicole said about collaboration is really going to be key to be able to work with government agencies and trade organizations to push for those exemptions.
Kendra. So, I mean, I'm just going to ask, as we come to a close here, to ask some sort of last words from each of you in terms of what would be your advice to our listeners in terms of actions that they might take? But I'm going to sort of add to that, I guess, maybe a specific question based on what you just said in your last answer, Nicole, in terms of our political voice and our capacity of influencing. So I don't know if that was going to be your answer, but if it is, so what? So I mean, we're politically neutral in terms of our conversation here today. So we're not telling you who you should vote for, but what should you be asking, right? What is the question you should be asking your potential elected representative or the different parties in terms of what should they be considering? What would I vote for?
That's a great question. And maybe I'll take it one step back before I answer that to
Sure.
say, on the sort of broader question on what steps can we take to prepare for these potential tariffs? I think it goes back to the partnerships and working together to have as loud a voice as we can in the healthcare community around what needs to happen and how we need to support our healthcare system at a time like this. So, we always say there's a patient at the end of every medical technology. And I am a recent breast cancer survivor. And I am very lucky. I am now cancer-free. But I 100% know that would not be my outcome without the medical technology industry and without healthcare professionals and without hospitals and without government. I got caught through the breast cancer screening program at the age of 50. We all play a big role in our healthcare system. And so as a patient who is thankfully alive today, thanks to all of these partners, I can say that we all need to come together and we all need to advocate together for patients to make sure that we are mitigating as much of the possible, challenges we're going to face because of what's going on. And not just in Canada. Look, we at Medtech Canada are working closely with our partners in the US, AdvaMed, which is our sister association in the United States. We both associations have the same message. We have to put patients first. And so not only do we need to come together as Canadians, but we need to reach out to our American counterparts whether it's the American Medical Association or the American Hospital Association or whatnot, but you only need to look at this podcast today. We've got HealthPRO Canada, we've got our hospital partners, we've got HealthPRO, a procurement group, we've got Medtech Canada, industry. We're all on the same page. We're all on the same team here. And bringing all of us together as one large, powerful voice for patients, in my opinion, is the most important thing we can do right now. Really, we got to raise the red flag. We got to really let people know what they might be facing if these things go through, and we got to work together to mitigate those issues. So that's what I'd say in terms of what we can do today and where we can go from here.
Yeah, thank you. And thank you for sharing your story, Nicole.
I mean, we've covered a lot today. I think at its core, it's not just about trade policy or procurement logistics is what I'm taking away. It's about sustainability of the whole healthcare system. And when you look at every delayed shipment and every price hike and every supply chain disruption having a direct impact on patient care, the tariffs, that is, they don't just inflate costs, they widen healthcare inequities by making life-saving treatments less accessible for the people who need them the most. That's a lot of really bad news. Is there any hope at all? Yeah, we're not powerless. We've talked about voting and asking certain questions in the next elections, and there are many of them coming up. So there's lots of opportunities. But those collaborative groups being healthcare organizations, GPOs, suppliers, policymakers, we have the opportunity to build a smarter, more resilient system now. And then, we're not at the mercy of shifting trade policies or egos or whatever you want to talk about.
Yep.
But we must rethink how we're sourcing and procuring the medical supplies, expanding those networks, pushing for policy changes, and leveraging partnerships with data-driven strategies. We do this work every day as a GPO. So my kind of final thought is let's not wait until the next disruption forces us to act. Let's lead the way with confidence and stability and work together to navigate this.
Yeah, thank you, Kendra. I would like to hope that we can all learn from these threats, if it's not a crisis at the moment, but to make some significant, long-lasting changes to the way we do business in this country. So thank you both for so passionately and generously sharing and your voices, joining us in this conversation today. Hopefully, coalescing sort of the hearts and the minds of those our listeners and those that they may share this with, to take action and to do something that will support our Canadian healthcare system and all those who depend upon it. So again, thank you for joining us, and I wish you well in your continued advocacy and work in this really important space.
Thank you so much, Dale, for bringing us together. Really appreciate that.
Thank you so much. Thanks, Nicole. Great conversation.
You've been listening to the HQ, and I'm Dale Sherbeck, your host. You can find this and other future episodes on the CHA Learning website, Apple Podcast, or Spotify. We'd love to hear what you think, so please follow us on our other social media channels. Thanks for joining us in this discussion today. Please join us next time.